interventional ultrasound in infertility practice. So let's start. The ultrasound guided procedures have made assisted reproductive technology, which is ART techniques, more accurate and less invasive. Procedures in which ultrasound guidance is used are tubal assessment. The first one is sonosalpingography, which is also abbreviated as SSG. As the name shows, it is the sonography of tubes. The other method used is hycosi. Hycosi is hysterosalpingo contrast sonography, which means we study the tubes, the patency of the tubes with the help of ultrasound and contrast media, which is introduced into the tubes to see the patency. Then other important things are ovum pickup, followed by the embryo transfer. Then other procedures are cyst aspiration in ultrasound guidance, hydrosalpinx aspiration. When we have hydrosalpinx, sometimes we can use it to aspirate. Embryo reduction in case of multiple embryos in early formation. For sonohysterosalpingography, we need a gynae couch. So patient will be on gynae couch. We need lithotomy or like position, a position in which we can introduce the TVS transducer comfortably, which is usually when the patient's knees are flexed and some abduction at level of both hip joint, abduction or external rotation. Clean with betadine. Pre-medicate with atropine 0.5 milligram and glucagon 1 mg. It will be better to give oral antibiotic cover, which can help. When we perform it, the best time is the follicular phase of menstruation, which is 6th to 10th day after LMP. After menstruation, 2 to 3 days after bleeding stops or before ovulation. Sonohysterosalpingography, we need catheter which is 6 FR, which is the extended diameter of 1.6 mm, and we can have an intermediate diameter of 1.1 mm. So the catheter is passed. FR is the French radius of the catheters, which are of different types like 1.2 mm, 1.4 mm, and 1.6 mm. They have given them colors like green, red, and orange. So here we need a 6 FR, which is 1.6 mm. So we will pass it through the cervix obviously through the vagina, then going through the cervix with balloon just above the internal os.